Hello, my name's Dr. Derek Cox and I'm a consultant in public health medicine, and I'm currently the clinical lead for contact tracing with NHS Grampian. So I've had quite a lot of experience as to what the hassles are about stopping the spread of this virus. So with schools going back after the Easter break, I just thought I'd do some reminding about some important messages, and these messages are for school teachers, they're for parents, and they're for pupils as well. So the first thing I really wanted to say was about not going to school with symptoms, and that covers children and teachers. Please don't go into school when you've got symptoms. And when I say symptoms, we know that there are many more symptoms of COVID than just the three primary ones of high temperature, chronic new cough, and a loss of sense of taste or smell. People can get headaches, sore throats, mild coughing, symptoms of a cold. So I know that it's difficult for you to keep your children at home, but please don't send anybody into school when they've got symptoms. Now, the next thing to say is, if anybody does have symptoms, and it just so happens that for some reason you've got a lateral flow test at home, please don't use this. The LFD test is for people who don't have symptoms, people who are asymptomatic. So if anybody in the household gets symptoms, they need to book a proper test through either the NHS or through the government testing system. So the next thing to say is about car sharing. I know it's not always possible to avoid, but if it's at all possible, try to avoid sharing cars in taking children to school. If you are taking your children to school or you're collecting them from school, don't hang about the school gates, please. And if you do have to wait about for your child to come out of school, try and remember the 2-metre distancing. 2 metres always is a bit longer away than you think it is. It's quite a distance, 2 metres.